secondary data basically means data that's already been produced. So primary data, we commission a survey, we administer that online like the BlueHealth International Survey. That's all kind of original primary data that we're collecting. Secondary data means that somebody else has been collecting routine data for another purpose, but we can basically take advantage of the fact that that's been done. And very often those data sets are available for the public or for researchers who can prove they have a good use for it. So we're interested in basically trying to see if there's an association between some kind of exposure to blue space, so living near it, living in it, using it, and the state of the population's health and well-being. And by health and well-being, I mean physical and mental health. So in this case, there's 3 data sets that we selected because they look at the same kinds of health outcomes. And they're in 3 partner countries for the project. So one's in the UK, one's in the Scania region of Sweden, and the other one is in Catalonia in Spain. And they all measure the same kind of health and well-being. So in these different populations, we know that the people have different experiences of the natural environment, and we're able to measure not only their health and well-being, but we can also use the locations of those people to work out what their exposures are to natural environments. We can compare apples with apples in the sense that we have the same outcomes. What we don't have is the same environments, but that's interesting. So if you imagine someone living in the centre of Barcelona, they have a very different experience to someone living in a village in the north of England. But that's fine. We can investigate whether the same effects are happening. Effects, I mean whether there's the same link between their going to a lake in one place and going to a fountain in the other, whether blue has some meaning. There's also the practical level of trying to do comparisons, which is that these data sets are only accessible in the countries themselves. Because one way of addressing this problem would be to take all the secondary data and lump it all together and analyse it in one big lump. But unfortunately we can't do that because it has to live in the countries and be worked on in the countries where it's made. So at the moment this is probably the biggest challenge, is how do we do a coordinated analysis of data when the data is sitting in different places? Where we're at the moment, we've reviewed the different data sets. They're complex things, the secondary data sets. We needed to see how comparable they are, how much we can get from each of them which can be combined. We've realised in this process that the Catalan data set is not looking at the same people over time. In the UK and in Sweden, we have the same people followed through time, possibly for their whole lives. These are ongoing long-term surveys. In Catalonia, they take 1,000 people every year, and they're always different. So we can't look at how their life experience changes over time. We're just looking at cross-sections. So we've learned quite a lot about how the individual data sets work. We've learned a lot about which kind of exposure data is out there for Europe, for the world, for individual cities. And the next step really is to plan how we do the analysis. So we take our individual's place of residence or whichever locator information we have, so their postcode, and we assign those. We put those on a map, we assign them their exposure data, and then we can do our analysis, which is a simple regression. That's where we're at, planning that regression.